McKinney Vento Homeless Assistance Act, as amended by the Homeless Emergency Assistance and Rapid Transition to Housing Act of 2009, authorizes HUD's Continuum of Care program, which provides funding to nonprofit, government, and other entities that serve people experiencing homelessness within a defined geographic area. The COC program interim rule requires COCs to use a coordinated assessment system, including a standardized assessment tool. The coordinated assessment prioritizes resources for those with the greatest need, match people with the services that are most likely to help them exit homelessness, reduce the time it takes for clients to access services, and ensure that limited resources are allocated efficiently. Additional benefits of coordinated assessment may include improved standardization of referrals because coordinated assessment relies more on the standardized inputs rather than on casework judgment, as well as an orientation toward the hardest to serve populations rather than households anticipated to be more responsive to assistance. So the use of this tool really basically removes the old system of cherry picking individuals for programs to guarantee success. Through coordinated assessment, COCs create a standard assessment process and community agreement on referrals so that individuals are directed to the most appropriate available services regardless of how they enter the system. The standard assessment process can both match clients with the most appropriate services and prioritize needs. Although COCs are eager to adopt tools and scoring systems from other communities, these tools may not always be appropriate for implementation in a different community. Choosing a tool without considering whether it's suitable for or applicable to the COC's goals may lead the COC to overassess, allow insufficient time for self-resolution of a homelessness episode, assess for needs without the ability to provide appropriate services, or use the tools beyond their intended purpose. In addition, different tools may define need differently, for example, in terms of risk of harm or mortality, risk of continued homelessness, or cost of service utilization. A strong tool would be dependable, produce consistent results, and have validity, measure what it claims to measure so that stakeholders could have faith in the instrument, and it would have predictive value. For the purposes of this discussion, the Vulnerability Index Service Prioritization Decision Assistance Tool, or the VI-SPDAT, the Alliance Comprehensive Assessment Tool, and the Hennepin County Eligibility Criteria and Rating Tool and Vulnerability Index were examples of tools that were used by communities. We chose to use the Service Prioritization Decision Assistance Tool, the SPDAT, as part of our Housing First process that we developed in the Brevard Homeless Coalition. The Service Prioritization Decision Assistance Tool, like I said, called the SPDAT, has been around in various incarnations for over a decade before release to the public in 2010. Since its initial release, the use of the SPDAT has been expanding exponentially and is now used in over 1,000 communities across the United States, Canada, and Australia. More communities using the tool means there is an unprecedented demand for versions of the SPDAT, customized for specific client groups or service delivery contexts. With the release of SPDAT Volume 4, there have been more current versions of SPDAT products than ever before. The VI-SPDAT series, the Vulnerability Index Service Prioritization Decision Assistance Tool, developed as a pre-screening tool for communities that are busy and may not have the resources to conduct a full SPDAT assessment for every client. In collaboration with Community Solutions, creators of the Vulnerability Index, is a brief survey that is completed to quickly determine whether a client is high, moderate, or low acuity. The use of this survey can help prioritize which clients should receive a full SPDAT assessment first. Because it is a self-reported survey, no special training is required to use the VI-SPDAT. And all versions are available online at orgcode.com. The Service Prioritization Decision Assistance Tool is an assessment tool for frontline workers at agencies that collaborate with homeless clients to prioritize which of these clients should receive assistance first. It is an in-depth assessment that relies on the assessor's ability to interpret responses and collaborate those with evidence. As a result, this tool is completed by those who've received proper up-to-date training provided by OrgCode Consulting Incorporated or an OrgCode certified trainer. To use the SPDAT training by OrgCode or an OrgCode certified trainer is required. They provide training on a wide variety of topics over a variety of mediums. The full day SPDAT Level 1 training provides you with an opportunity to bring together people for one low fee. The online seminar training allows for a maximum of 15 different computers logged into the training at one time. They also offer online courses for individuals that you can do at your own speed. The training gives you a manual, case studies, application to current practice, a review of each component of the tool, conversation guidance with prospective clients, and more. SPDAT products developed by OrgCode Consulting with extensive feedback from key community partners includes people with lived experience. The tools provide free of charge to communities to improve client-centered services dedicated to increasing housing stability and wellness. Training is required for the administration and interpretation of these tools. Use of these products without authorized training is prohibited. By using the tool, we accept and agree to be bound by the terms of that expectation. No sharing, reproduction, use, or duplication of the information without the express written consent of OrgCode Consulting is prohibited. Although the SPDAT series is free of charge to communities, the training must be completed. After meeting the training requirements required to administer and interpret the SPDAT series, practitioners implement the SPDAT in their work with clients. You may not use or copy SPDAT prior to successfully completing training or its use provided by OrgCode Consulting or a third-party trainer authorized by OrgCode. You may not share the SPDAT with other individuals not trained in its use. You may not train others on the use of the SPDAT unless specifically authorized by OrgCode Consulting. You may not modify the SPDAT or create any derivative work of the SPDAT or its accompanying documentation without the express consent of OrgCode Consulting. The management and staff of OrgCode Consulting do not control the way in which the SPDAT will be used, applied, or integrated into related client processes by communities, agency management, or frontline workers. OrgCode assumes no legal responsibility or liability for the misuse of the SPDAT, decisions that are made, or services that are received in conjunction with the assessment tool. Research from the California Policy Lab was able to provide the following results of the use of the assessment tools. All unsheltered homeless people report significantly more health concerns. Unsheltered women are extremely vulnerable and much more likely to have experienced recent trauma. Unsheltered people have exceedingly high rates of police contact, not explained by race, age, gender, health, time since stable housing, or other factors. Unsheltered people have high rates of emergency service utilization explained by health concerns and length of time since stable housing. For the sheltered population, vulnerability jumps after 1 year of unstable housing. Mental health concerns are dramatically lower among older, 55 or older, sheltered individuals compared to younger individuals in shelters. Sheltered individuals under 55 have an average twice the police contacts and 66% more jail spells than sheltered individuals over 55. Sheltered individuals under 55 also have 30% more ER visits than sheltered individuals over 55. Unsheltered individuals over 55 report an additional 1.4 ER visits and ambulance rides over unsheltered individuals under 55. Housing placement patterns seem to match acuity as measured by the VI SPDAT scores. In our model, the outreach team member asks the individual if they wish to become housed, if housing is available. If they agree, the outreach team member completes the VI SPDAT to quickly determine the level of vulnerability for the client. If the client shows a high level of vulnerability, then a complete SPDAT is completed. The SPDAT results are given to the weekly coordinated housing assessment team, we call the chat. The chat will sort the results by highest vulnerability for available housing, usually in our case through the Brevard County Housing Authority. So I certainly recommend that as an organization that you use the vulnerability index for a number of reasons, but primarily so that the most vulnerable and not the least vulnerable are housed first, so we can move towards housing stability for all. Thank you.